Hi, I'm Dr. Zodkoy. I want to talk briefly about an epidemic in America, and it has to do with stress and anxiety, which leads to adrenal fatigue. So much of my practice is spent treating patients with a lot of aches and pains, whether it be neck pain or back pain. And a lot of times what I find is it's tied back to their bodies not being able to handle the stress and anxiety of normal life. Now, part of this is due to the fact of our diets, where we're drinking too much coffee and too much refined sugar and not eating enough fruits and vegetables. And part of it's caused by the fact that we're never off anymore. We're constantly checking our cell phones, we're checking our emails, and really we have no downtime. I see people all the time driving their car and multitasking. I know my own wife, she can't put the cell phone down even when she goes to bed at night. So what's happened is that we've overstimulated our bodies, and our nervous system and our hormone system can't keep up with the stress that we're creating. And that causes a big overload and eventually a weakness in a gland called adrenal fatigue. Now, the important thing about adrenal fatigue is that it's not actually a medical disease. So you can go to your doctor and complain about fatigue, stress, joint pain, and what really they tend to diagnose you with is fibromyalgia or anxiety or depression, and not get the proper test done, because the test needed to be done is called a saliva cortisol test, and it needs to be done 4 times during the day, and it's not a standard medical test. And even if it is done, very few people show to actually have a disease with their adrenal glands. So people tend to get worse and worse and worse, and then eventually they end up in our office. Right now we're dealing with a lot of patients who have post-traumatic stress disorder from military service, but just post-traumatic stress from just being overworked. And one of the things I like to explain today is, if you have anxiety and stress, or if you have aches and pains and been diagnosed with fibromyalgia or chronic pain syndrome, or just been told it's all in your head, it's psychosomatic, I'd really like you to look into adrenal fatigue syndrome and read up a little bit about it, because there's a very, very simple saliva and urine test that will help to diagnose it, and then the treatment is very, very simple. We put you on some nutritional products, we use some reflex points, we help you deal better with stress using what's called an alpha stim unit, and what you'll find is that in 30 to 60 days you're feeling dramatically better, and in 120 to 180 days not only is your pain gone, but your moods are improved, your sex drive comes back, and you got that old oomph that you've lost over time. So look into adrenal fatigue if you have anxiety and stress. And if you haven't had the proper diagnosis, give us a call and we'll be glad to help you get the right testing done.